Okay, hello everyone, and welcome to the NNE-CTR seminar. This week we have speakers from the Community Engagement and Outreach Core presenting a talk, The What, Why, and How. Before I introduce the speakers, I'll just introduce myself. My name is Katie Modal. I'm one of the scientists at Maine Health Institute for Research. And I'm joined today by Andrew Fritz, and he will be managing the Q&A session at the end. So feel free to put questions in the chat, and then also we'll reserve some time at the end where you can raise your hand and speak up and ask questions, or we'll try to address the questions that are in the chat. Andrew, did you want to say hi?
Hello, I'm a faculty scientist in the Stein Lab researching breast cancer epigenetics. So that's basically it. So.
All right. So we'll get started. So today we have Jan Carney, who is the Associate Dean for Public Health and Health Policy and Professor of Medicine at the University of Vermont. We also have Elizabeth Woods, a Rural Research Navigator in the Core at the University of Vermont. And then for main contributors today, we have Emma Daybranch, who is a Rural Research Navigator, and Carrie Sullivan, who is also a Rural Research Navigator. And so without further ado, welcome speakers, and thank you all for attending.
All right. Thank you. Thank you, Elizabeth. I first want to just thank all the other presenters on the call. Kathleen Fairchild and I are the core leads for the Community Engagement and Outreach Core in the CTR. And Carrie Sullivan, Elizabeth Woods, and Emma Daybranch will all be speaking as well. So next slide, please. So these are our Community Engagement and Outreach Core aims, just to remind everyone what we're trying to accomplish. To engage investigators and research to address health disparities and equities in Northern New England, to increase Northern New England community engagement capacity, and to expand our current partnerships among academic centers, rural healthcare practices, FQHCs, community organizations, and the Northern New England Practice-Based Research Network to increase community-based research projects. Next slide, please. And this is just one of the graphics about our core that's on our website. And it says our Rural Research Navigators, and now we're using the terminology Community Engagement Research Navigators, and I think you'll see why. And we serve as a bridge connecting a wide network of partners. Next slide, please. I want to talk for a few moments about the science of community engagement. And I just want to start with this definition from the NIH, which is on the link is below. And this is it with regards to clinical trials. And emphasize it's the process of working collaboratively with and through groups of people. It often involves partnerships and coalitions. And finally, community engagement can take many forms, and partners can include organized groups, agencies, institutions, or individuals involved in many domains related to health. Next slide, please. There are a variety of published models related to community engagement, and I wanted to show you just a couple of these that I found particularly helpful. This is from a 2022 publication from the National Academy of Medicine that talks about 8 characteristics of an effective community engagement model, defining what should be measured in meaningful community engagement, not necessarily what's currently measured. It has to be flexible so that we can use it in a variety of communities. Defining health in its broadest sense, and making sure that the community can see itself in the language and measures that we use, embedding equity throughout everything we do, emphasizing our outcomes of meaningful community engagement, presenting a range of options for different stakeholders, and then communicating about the dynamic and transformative nature of engagement, which takes place over time. Next slide, please. Now, this is a very busy model, but I would invite you to focus on a couple of things. And this is from the National Academy of Medicine, and their big goal is health equity through transformed health systems. But I would suggest that we look at in that green circle, the core principles for community engagement. Trust, bi-directional, inclusive, culturally centered, equitably financed, multi-knowledge, shared governance, ongoing, co-created, co-equal. Those are the kinds of words that really can help us develop those partnerships and relationships for successful engagement. If you just go a little bit to the left in the oval that's called strengthen partnerships and alliances, you'll see diversity and inclusivity, partnerships and opportunities, acknowledgement, visibility, recognition, sustained relationships, mutual value, trust, shared power, and structural supports for community engagement. Those are the most important things in my view of this model. Next slide, please. Here's another one I think that helps us illustrate how we have to merge sometimes different perspectives. And this is from community engaged research and citizen science. And if you look at the top in the blue part of this, research enterprise includes, and it's community, that is CENR's community engaged research. So start at the end of the big arrow. We have PI expertise and a scientific question. And move to the right, we develop our aims and methods. We implement a study. We collect and analyze data. We publish and disseminate, and then the process repeats. Now, compare and contrast that. Go down to the bottom and look at the perspective of the citizen science enterprise, and go to the far right side. It starts with sometimes some kind of exposure or disease awareness and a concern, a health concern and a question. Now move to the left, engage scientific questioning, collaborative research, reviewing results, and a goal of translating the findings for public health action. So the challenge for us in real terms is, how do we connect both these two different perspectives? Next slide, please. Just a few additional themes from the literature, and we provided these resources and the PubMed links for you at the end of this. But this is an article from O'Mara Eves and colleagues, and looked at the results from 131 studies and a meta-analysis, and indicated that there is solid evidence that community engagement interventions have a positive impact on health behaviors, health consequences, self-efficacy, and perceived social support outcomes across a variety of conditions that they studied, but that there is insufficient evidence, particularly for long-term outcomes and indirect impacts, to determine whether one model is better than another. So back to that theme of flexibility and how we engage with different communities, and that the interventions are effective across a wide range of contexts, and including a variety of mechanisms. Next slide. One additional reference to a study in the literature. This is from Key and colleagues, and this looks at the continuum of community engagement and research. And in this figure, this shows the continuum of community engagement and research. If you focus on the middle, and you'll see the spectrum. On the left, there's no community involvement, all the way to the right, which is community driven and community led. And in the middle, some different level of community participation. Now, these things are often informed by, if you look down at the bars below, contextual factors. What is the history of those partnerships or engagement? Is there trust? How much relationship building and respect and openness about what activities are occurring? And if you look at the bar above, some of the important equity indicators, such as power control, how decisions are made, resource sharing, and who owns different responsibilities. Next slide, please. This is another example of the involvement and activity in this continuum of community engagement. And in the center, again, is the spectrum of from no community involvement to the left, all the way to community driven and led. And if you look at from above, you see community involvement and activity in the bar above. For example, the community is not included in any aspects of research. To the middle, the community have some active role. To the extreme on the right, the community leads and owns the research. And if you look at the lower bar, this is the researcher involvement and activity. On the left, the researcher works independently of the community. All the way to the right, the researcher supports community identified research efforts or serves a minimal or no role at all. Next slide, please. And this final figure from this paper shows the differences in perspective and experience. Again, in the middle is the different spectrum of community involvement and community engaged research. And on the top, what's the perspective of the community? To the upper left, we don't know about this project. In the middle, there are some opportunities the researchers have provided us, for example, such as a community advisory board. And all the way to the right, we fully own the research. And if you look at the lower bar, the researcher perspective or experience on the left, we had no contact with the community. To the middle, we have a defined role or roles for the community to participate in the research. And to the right, the community is in charge and we support their efforts when asked. So our challenge in terms of community engagement is to be deliberate about finding specific ways to engage the community and also be conscious about to what extent we are and aren't, and how that might vary depending on the type of project, where it originates, and what our expectations are, for the community and theirs of us. Next slide, please. So this is a slide that we used and we put into our CTR renewal application, again, to be very concrete and deliberate with what we've learned from the literature and how we apply that to our community engaged research. And you can see from left to right, again, increasing level of community involvement, impact, trust, and communication, from everything from outreach to consult to involving to collaborating to shared leadership. And I would just point to the middle one, involvement. For example, communication flows both ways. Better community involvement. Entities cooperate with each other. There might be more deliberate community involvement. But my point is that there are models from the literature. There are specific examples of how we can engage with community partners on an ongoing basis. Next slide, please. And these are my final takeaways of to create sustained systems of community engaged research. Community members are expert in their community. We have expertise in research. I would suggest you consider and ask what is important to the community you're working with. Do this on a regular basis, not just one time. And what does community mean in this context? People have different definitions of communities depending on what types of research they're doing and where they're doing it. Is the community a geographic area? Is it a specific population that we're trying to engage? Consider your stakeholders for each project. Consider each project as the first of many. To me, this is a mindset. It's not a check the box. And I'm reminded one of our projects we're currently working on with partners in Maine is called the RADx project. And we're trying to understand predictors of COVID-19 testing during the pandemic using both quantitative and qualitative means in order and to understand what is going on with rural and vulnerable communities. When I think about, and it's a wonderful research project. When I think about the benefits of that, I'm thinking about everything that we're learning, not only for COVID-19, but how it will help us engage with different geographic areas and different populations for potentially additional projects and those relationships for the future. Use existing networks, coalitions, organizations. When we think about it, we might think first about our healthcare and healthcare delivery system and our research networks. Think also about the networks and coalitions that are out in the community, and because those can be extremely helpful and as we develop these partnerships. Develop and organize ongoing conversations and collaborations. Figure out, is there a way that this can happen on a regular basis, such as community advisory boards, or we're currently using community engagement councils in our core across both states. And finally, remember that process is important. I just invite you to remember the increasing levels of community engagement and trust and what we've learned about the potential short-term and long-term benefits for us and communities. So I'll turn it over to Elizabeth now.
All right, thank you. So I'm going to kind of switch tracks here and talk a little bit about the services as community engagement navigators that we provide. So as navigators, our goal is really to connect and facilitate relationships between researchers, clinicians, and community members to advance health research in Northern New England. We really try to meet people where they're at and tailor our services to their needs. So I'm just going to give a few examples of the typical services that we provide. So first, we connect researchers with resources and people. So just as an example, a researcher came to us wanting to recruit people with breast cancer in rural areas of Vermont for her study. We were able to make introductions and put her in contact with partners from Vermonters Taking Action Against Cancer who work directly with cancer survivors. She was able to connect with a variety of survivor organizations that were able to help her find study participants. Another one of our roles is to connect clinicians or providers who want to do research but don't necessarily have the resources or the expertise. So we put them in touch with the other CTR cores who have experience in study design and IRB designations. So for example, we've been working closely with Planned Parenthood of Northern New England on multiple projects over the past few years. We helped them apply for a grant by connecting them with the Bird Corps for consultation services on study design and data analysis. Gary Stein from the Admin Corps helped provide insight into the various definitions of virality to strengthen their proposal. And finally, the Professional Development Corps provided IRB assistance. So we currently have biweekly meetings with them and with the Bird Corps staff to discuss their data in preparation to write a manuscript for publication. We also collaborate with the other CTR cores to embed the principles of community engagement across the grant. We reviewed all of the pilot proposals for community engagement and are currently working with them to develop a system for scoring and review process. We're collaborating with the Professional Development Corps to create trainings on community engagement practices. We've been working with the admin and professional development corps in both Vermont and Maine to jointly facilitate a series of ECHO trainings. So we've recruited 6 faculty for presentations and 6 investigators to present case studies in monthly sessions since August. One investigator went on to receive a CTR pilot award. We routinely work with the Bird Corps, as I mentioned, on a variety of projects, and we're consulting with the Tracking and Evaluation Corps on how to collect meaningful data for our efforts. And finally, we provide consultation services for researchers on how to best implement community engagement practices in their projects. So every kind of research is going to benefit from some kind of community engagement, but the specific method and timing can be different just depending on your project and your goals. So here are some examples of community engagement strategies across the continuum that Jan shared earlier. And I'm going to hand it over to Emma to explain it further.
Thank you so much, Elizabeth. So as Elizabeth mentioned, in our role, we're here really to support researchers in navigating what is most appropriate for each research project across that translational spectrum. And of course, it varies. As the chart shows, some projects are poised to be community-based participatory research projects, and others really could benefit from one-time consultative session or support with dissemination. And we as community engagement and outreach navigators are here to help navigate, what is the appropriate engagement plan for your research and what's the right activity for you, considering where your research is in its life cycle. So just wanting to make that really clear and concrete, and we're excited to sort of talk through some of these examples, including community engagement studios. But pointing out that we also, provide opportunities to connect with community health needs assessments and understand sort of health disparities and community health priorities, as well as, provide connections to community engagement councils and support with things like dissemination or connecting with dissemination opportunities that are appropriate to your research. So just to name a few, and I'll hand it back to Elizabeth to talk through an example of a consultative support for researchers in Vermont.
Sure, thanks. So one of our best examples of using the principles of community engagement in our practice is with a researcher here at UM. So she's new to the university and had heard about the pilot projects from her mentor. She requested help writing her pilot submission with an eye on how she could really use community engagement methods for her research. She came with previous experience in community engagement and even introduced us to a method that we weren't very familiar with. But even though she had a lot of previous experience, we were able to provide an additional layer of navigation expertise to really strengthen her proposal. We assisted her with the nuts and bolts of the pilot grant process and encouraged her to present to the ECHO to get feedback on her project from other investigators. After she was awarded the grant, she then helped us for help with navigating the next steps towards implementing her project. And we connected her with resources and people who live in the community where she's going to be implementing her research. We're really looking forward to her carrying that out. And if she needs help with analyzing her data, we'll be here for that too. Back to you, Emma.
Sure, yeah. So I'm just going to talk through another example. If we could go to the next slide of one of these sort of community engagement infrastructures that we're working on bringing to Maine Health and really excited to be bringing to Northern New England. So this example is called Community Engagement Studios, and it's a community engagement research infrastructure that is really becoming popular across the translational science community, including at all these institutions pictured here. It was first developed at Vanderbilt and is being utilized, as I said, by many of these institutions. The method was developed as many researchers are not prepared to identify, recruit, convene, and engage stakeholders or prepare them for participation in research and advisory capacity or as part of the research team. Because as many of you are probably well aware, this takes a lot of time and energy and resources to do this well. So the CE Studio creates a framework for stakeholders to provide immediate feedback to the researcher on specific areas of concern before research projects are implemented. For example, instead of guessing at what a recruitment flyer, what would be really effective at a recruitment flyer, you could work with the community who is identified to, ensure that that is really developed in a way that is meaningful and will connect with the audience. It's specifically designed to address many of the common barriers to engagement, such as power dynamics, trouble with recruiting, time commitment issues, convenience, and relevance for all involved. Next slide. So you might be asking yourselves, what is this thing that we're talking about, this community engagement studio? So it's a highly structured process, and as I said earlier, it's specifically developed to address major barriers to community engagement or convening stakeholders. It's a one-time 2-hour meeting meant to inform a research project by getting input from people who represent the research population of interest, or what we like to call community experts. They're experts in their own experience. The meeting is supported and facilitated by the Community Engagement Studio team, which in our instance is going to be our CEO CTR cores. And the team is usually about 3 people: facilitator, tech support, and note taker. And the studio team supports the researcher in preparing for the meeting, as well as recruits the appropriate community experts to show up. And this graphic here really walks you through the process. At the end of the day, the Community Engagement Studio provides a framework for researchers to work directly with community members, patients, caregivers, and other individuals to get meaningful insight on planning, dissemination, implementation, translation, or other aspects of their research, and are really specific and in a way that is both a light lift for the researcher as well as the stakeholder, which oftentimes is something that is really helpful and is sort of a low barrier entry into community engagement. Next slide. So a common misconception is, how is a community engagement studio different from a focus group? And I just want to quickly clarify this for all of you who are sort of new to this type of infrastructure. The main difference is that the studio is not a meeting to collect qualitative data. It's not a meeting where research is taking place. It's not for publication. In a paper, this activity would be included as a methodology. It's meant to support, improve, enhance research design, implementation, translation, or dissemination. I said earlier, and participants are not human subjects being researched. They're really community experts being consulted with the purpose of improving research. And so this is reflected throughout the process. And we have worked with our IRB, and it's a not research activity at the Maine Health Institute for Research. So the next slide. Lastly, I just want to say that the team here in Maine has had the opportunity to hold our first studio this spring, which we're really excited about. This studio was on financial distress due to cancer care. We had 8 community experts for the session. It was a real success, and we're really excited to be able to host more of these going forward. And yeah, so I'll pass this on to Carrie, my colleague, who has a few more things to add.
Yeah, so I think it's this was really fun. We had 8 folks who participated, and I think due largely to Emma's great recruitment prowess, we almost had 14. So we did. It was really exciting to get that kind of response from the community, and I think ongoing we'll see how the researcher uses it. But the next couple slides are just to talk about how has the response been? And so the same team that created this infrastructure out of Vanderbilt, they did a follow-up survey, looked at studios they had held between 3 months and 3 years. And so they looked at 75 different studios, which included 65 researchers and 591 community members in this study. And they found that 100% of researchers would do it again, would request a studio again, and 99.3 community members, I guess 0.7 of a community member didn't want to do it again. But anyway, 99.3 community members would also participate in a studio again. So that's just really exciting. It gets to what Jan was speaking about with that bidirectional piece, having researchers and community members work together. And some of the benefits that researchers reported getting out of it is it increased their understanding of the community, it increased their sensitivity to the community, and it gave them feedback on the appropriateness and the feasibility of the study. And so the next slide just shows, is from the same study, and it just kind of shows what, if anything, researchers plan to do or change as a result of being part of this studio. So you can see it really, the biggest change is that it really prompted them, I think encouraged them to continue their level of community engagement in their research activities, but also gave them great feedback about, reducing jargon or changing their consent process. So you can see all along the continuum, it's really helpful for the researcher. And so that's why we're excited to be able to bring that as a tool to add in the community engagement process for folks who are participating in the NNE-CTR. And then the very last example along that continuum, we've talked a little bit about consultation and sort of help, one-to-one help. This is a thing happening here in the mid-coast of Maine where I'm located, and could be happening in any community really. But it's, Jan had talked about that, those two, the green arrow and the blue arrow. And if you remember, on the green arrow all the way at the end was like, what does the community identify as a problem, or what does the community identify as a challenge? And so some elementary schools in the area are having a really hard time with increased behavior of mental health issues and behavior of students. And so just a couple of school leaders kind of started asking, putting this out to the community, and started partnering with other groups. And this picture on the left, you can see is they held a meeting, and they thought like 20 people would come, and 200 people actually showed up to talk about the issue. And so out of that has kind of come this collaborative, multi-sector collaborative effort to start to address, how we can improve conditions for families and youth in the mid-coast. And so because as a research navigator, I'm here in the area, we're able to participate in this from the get-go. And there's a small research team that's kind of working as this group gets established, along with many other teams that are part of this effort. But it's just an example of how now we'll have opportunities to identify research and do it with the community in partnership. It could lead to co-PI-ship, could lead to co-authorship, could lead to a whole host of things. But this is an example of sort of being in the community and with the community from the very beginning as they try to grapple with a problem that they'd like to solve. And so I think that wraps up the examples we wanted to share. And I don't think anyone told you there'd be a quiz, but we do have a quiz. And I'm gonna maybe try and move you over as I can't see everybody, but just a couple of, why should we care, and why should we really increase and strengthen our efforts around community engagement. So the first question is, good evidence is automatically translated into action. So true or false? If you think that's true, raise your hand. If I can, I know I can't see a lot of you, or put your answer in the chat. True or false? Oh, you guys are good. Okay, so in the interest of time, I'm just to say yes, it's actually false. And it is, some of you may have heard some of this research. The sort of seminal research on this is that it takes about 17 years for evidence to be translated into practice, into clinical practice. And even of that, the evidence that's translated, only about 14% of the evidence is translated into clinical practice. And there's lots of examples where, only 50% of the preventive medicine recommendations are being put into practice, and places where people can't even get access to evidence-based because either the directions or the way it's implemented is very confusing. And so that's really where these partnerships, working together from inception to dissemination, can really help us strengthen that and have an impact on that situation, because the research is so important. We want to see it put into practice. So I can't see, I think I'll give you an A on that one. Okay, the next one. Participants in health research represent a diverse cross-section of the community. Anybody want to throw their answer in the chat on that one? So I'm just seeing a few, but that is right. Unfortunately, Kathleen, yes. That's unfortunately not true either. Historically speaking, the vast majority of research has been conducted on 0.1% of the population. And a lot of times research subjects come from academic hospitals. So we're really missing the opportunity to include a wide cross-section of the community, and especially those who are most affected, where health disparities live and where those issues are. So again, some of the tools and techniques that Jan recommended really help us get out into the community and help engage to get more diversity into our research. All right, next one. Community partners and stakeholders will readily trust you because your research is good and important. I heard. Right. So that's a challenge, right? That's a hill we have to climb, is increasing our trust. And many of you will remember from your city training and research ethics that there's some mistrust from the history there, but there's also mistrust because a lot of times as researchers, we speak a different language than community members, and it's hard to translate, or sometimes researchers come when they're during the recruitment phase, but then we might not hear what the results of that research was. So again, the community engagement resources can really help to develop those long-term relationships or help assist you to get support in engaging the community throughout all aspects of the and our relationships for the navigators. Some of us we're located right in the community, building those trusting relationships, and so we're here to help sort of be a bridge between researchers and the communities. And then the last true or false is the review of scientific research grants is increasingly including community engagement and stakeholder inclusion in its scoring. Yep, I see some yeses and trues. True, that is very true. You've probably experienced this yourself, but someone just shared with us the other day a rubric that was asking if community needs had been consulted, if there was evidence that the project team would be working with the community. And so definitely this is something that is on the rise. And again, we're happy to be there to help support you. Not a standard part, but it's growing. I mean, certainly even in the NNE-CTR, we've seen the increased emphasis on community engagement. But and I think going back to the why of really wanting to make sure that that important research that's happening is getting translated into practice. So I give you an A. I don't know. I think you did great. Thanks for participating in that, and I'll turn it back over to Elizabeth and Jan.
All right, this is the, thank you very much. And this is the end of a formal part of our presentation, and we've given you some information about, and we have some references for you about the science of community engagement, a lot of how we do our work in this core, and you can hear about the work of our navigators in helping real projects be successful. And you've also heard a little bit about the community engagement studios. So we'd like your feedback. What additional services can we offer to you? Are there structured meetings or that would be helpful to you to include community engagement in your research? We, of course, would love you to be enthusiastic about potentially participating in studios, but we'd also like to hear your other ideas for any ways that we can help you include community engagement. So I'm going to mute myself and open that up for any questions. You can raise your hand or unmute or put something in the chat.
Go ahead, Gary. This is Gary, actually from Maine right now. To what extent do the State Departments of Health contribute towards relationship building as well as supporting initiatives that are either initiated by the community or initiated by the academics on the academic side.
Would anybody besides me like to respond to that?
Get partial credit.
Could you restate the question again, Jan? I missed a little bit of the beginning.
I'm gonna ask Gary the same thing. Me too.
Yeah.
I think, Gary, if
To
you
what
move a little closer to the microphone, that might help.
To what extent are the state departments of health partners in terms of community engaged investigation?
Okay, so it's to what extent are departments of health as partners in community engagement? I can speak for myself here in Vermont, and they've been very, very strong partners and advocates. All right, and I would say that going forward, there are no shortage of opportunities to partner. We saw that in COVID-related research, but we know that on an ongoing basis. Here in Vermont, our Department of Health, statewide Department of Health, has 12 districts, and we are actively trying to work with them for those and using their expertise and referring us to other groups and organizations in the community. And so Carrie or Emma, would you like to speak to Maine or Kathleen?
I was going to invite Kathleen if she wanted to mention. I don't want to put you on the spot, but I know you're doing a lot of work with partners.
Yeah, I guess I'd say, Gary, I have not yet worked with, if you're talking about like the Maine CDC or the Maine, government structure. We've been working with the city of Portland a fair bit, just because they house some, the Portland Community Free Clinic, who we've worked with a lot on our RADx Up study, funded by the supplement to the Northern England CTR. And they've been great in that, there's some space actually. We've done patient recruitment. City of Portland's space at 39 Forest Ave right downtown, which houses the free clinic, the needle exchange, and the STD clinic. We've co-hosted one of our COVID testing clinics, like basically the no barrier clinics. One is in front of one of the homeless shelters, one is in front of this City of Portland, and one is in front of buildings, and one is in front of the federally qualified health center, Greater Portland Health. So that's a real kind of literally bricks and mortar structure. We've had great involvement from people from the city of Portland on our community and scientific advisory board for the RADx Up project. And so they've, we've explored some things that haven't worked out, in fact, too. We've talked about other groups that we were trying to reach, and, kind of through some of those connections, tried to reach people. Sometimes it doesn't work, sometimes it does. So that's gone well, I would say. Is that what kind of getting at what you were asking, Gary?
Yes, I know from the Vermont experience, the RADx grant that Jan and Yvonne Young have, the initial application was developed literally with the Commissioner of Health.
I'd love to do more of that for sure. I think as we think about, sort of next steps for community engagement across both states, maybe we could pull people together. We have some terrific people in Maine. I know Jan's super connected with everybody in the leadership in Vermont. Well, we could get people to a Zoom meeting at the least, right?
Right. Yeah,
we've been working with the Maine CDC. So one of the problems that was identified was the inability of primary care physicians to treat long COVID. So we're working on a statewide program with Maine CDC, disseminate educational programs and develop a webinar. And so coordinated through Isaac Benowitz at Maine CDC, but it's Northern Lights and as well as so there is some statewide coordination that's going on that Dora Mills helped us that.
Yep. Thank,
So there is some work going on at the state level.
thank
Okay.
you.
So the next question I wanted to address is from Chris Franklin. I saw Jan, you responded to this potentially, but maybe expand upon it. And Chris says if he can get his VBRN faculty to sign up for the NNE-CTR, can they consult for this type of work?
Yes, an enthusiastic yes. And absolutely, please, reach out, and it depends what people would like. For example, sometimes, presentations similar to this, it might be a studio, it might be a one-on-one with a navigator, but I have to speak about that, that our navigators in both states are just superb. So please reach out.
So Jan, is there does the CEO have a sort of site on the web, on our web, that can be open for a consultation? I could appreciate an investigator who just either is in the CTR or is not, who goes to the site and said, geez, I saw this video, I saw your presentation, I'd really like a consultation. So a very first starting point, even before we talk to some of the people who are directly related to these, rather just as a screening point.
I think that's absolutely possible. I guess I'll work with Sheila and we'll see whether or not we could put some more direct live button on the website. That might be very helpful, and make sure that our contact information is prominent there, but absolutely.
Okay. The next question, what ways can these practices include or engage local hospitals, universities, or district public health councils? What are the ways, resources, grants, indirects, opportunities, student training can be linked to these practices, especially in rural communities? Anyone?
All right, I'm going to open that one up. Who would like to jump in? Carrie, Elizabeth, Emma, please.
Well, I would just say yes, and I think it's and I think Catherine, your question too was also about the lack of funding. I was going to say that one way we're already partnering in Maine is with the state health department is participating in the community health needs assessment process. And also, like Jan had said in the presentation, looking for collaborations that are already happening, looking to partner and make relationships with collaborations that are already happening. So a lot of times in the local areas, those collaborations do engage the local public health council and sometimes the local health improvement arm or the clinical arm of the hospital. And so I think it's really looking for those places where those collaborations are already happening. I don't know if Emma or Elizabeth would add anything different.
Yeah, I was just gonna say, I really, the first thing that comes to mind is in Maine, Carrie's located on the coast and I'm located in Western Maine. So we're really working directly in those communities. And in terms of, I work out of the local hospital up here. And so we're really aligning and coordinating as much as we can in those scenarios. So aligning with CHIP plans, like Carrie mentioned, being a part of the China process, as well as those CHIP creation plans, and seeing, how can we really support these really the local efforts. And I think the piece around district public health councils, as well as public health infrastructure in Maine, there's a real challenge there around effective, well-funded infrastructure. And, I think regionally that looks different. And so how we can partner looks different as well. Same with universities, which I think there's lots more opportunities to do all that.
I can mention students here, student engagement. We're already There are a lot of students, both there's medical and public health students here in Vermont, and there's also medical and public health students in Maine, correct? And so we have on our side with our core, we currently have a group of medical students looking at health literacy related items and surveying people about participation in clinical trials, for example. And we'll also have our Vermont Cancer Center has funded a medical student to conduct research around rural health communication with us over as part of a summer project. So yes, there are definitely opportunities.
Another opportunity is through the Northern New England Practice-Based Research Network, the co-op,
Yes.
which includes Maine, Vermont, as well as New Hampshire.
Okay, in follow-up to that, Catherine was mentioning, in follow-up to that, how do you address the lack of institutional funding capacity in the public health districts, and then parentheses in rural universities?
I mean, yeah, this is an ongoing problem. I mean, I think in rural local areas, braiding of funding is just something that commonly happens when these collaborations form. And then I think we can also be helpful, just like we are with researchers, to help look for grants, excuse me, and help, I mean, finding resources is always a part of the development, I think, of any project that gets off the ground. And so that kind of naturally forces collaboration, but at the same time, I think it's always something we have to address.
And I think oh, sorry, Jan.
No, go ahead, Emma.
One thing because I think it's mentioned even directly, like, grant indirects, and I think being really conscious of how, who's holding that funding. And when we're working with partners, we're really trying to think big picture around, how can we effectively collaborate, including with who's the one holding a grant. And yeah, so just being really conscious of what that looks like, the piece of what we do.
Kathleen, did you want to, I can comment on some of the strategies I've used in terms of when there's no money, but did you want to?
I think we're going to say some of the same things, Jan, but I was just going to say, I think we could really continue to make use of existing data. So we just have, fantastic, we've across the main health system, we've been on EPIC, the EPIC electronic medical record for, since 2013. Really a wealth of data that we can draw on and work with the Bird Corps for analytics if people need help with that. So and things like common IRB applications, I think we should do more of that, where we just can add people in, make it a lot less painful for them, and then using other public health data that we can access, like main behavioral risk factor surveillance system data, registry data, etc. And I know Vermont, you have all the same systems. So we've also worked a lot with the all payer data, and Tim Plant and I collaborated on early pilots from this, from the Northern New England CTR. It's just, it's a great way to look at Maine and Vermont really strategically, and have, some of our community collaborators ask good questions, and then we can help them, get through some of these barriers. Like, how do you get the data? How do you get someone to analyze it? How do you get through the IRB, etc.
Okay, and along the very similar lines, I'm sure you've already touched on some of this, but can you speak to what you expect the sustainability to be for this work beyond this grant? What the funding opportunities do you envision in the future?
I'll start with that. I think there are, as a result of this grant, and mostly as a result of the relationships we build and how we're actually doing our work, that there are a variety of new grant opportunities and potential collaborations. So I'll start there.
Okay.
Megan has her hand up.
Oh, yeah, Megan, you can ask a question.
Great, thanks, Jan, and hi, Jan and Gary, and all the speakers today. This was a really great presentation. I'm a new leader with the co-op, as Gary mentioned. a partner with the CTRN. So I'm very excited to be here and to collaborate with this productive group. So my question is more about, do you have policies and procedures documented to like either vet or process external proposals that come in? And this could be either at the community engagement level or maybe more so for like academic researchers. But I'm just wondering if you have like a policy that you fall back on how to vet those.
Maybe I'll start. I would say that, for example, there's procedures that the pilot projects core, when they put out their call for proposals. So that wouldn't be our core, but we work closely together. Our different cores follow a guidance of how they get proposals and review and score proposals and use reviewers for that. That's one thing. I can only speak to our sort of where are we in terms of our community engagement council. And I would say we're at the point where we're starting to develop research, try and get a more robust sense of, from their perspective, what are some areas of priorities for research, as opposed to being far enough along to say, okay, now how do we sort of evaluate those? So I would say for that domain, we're not there yet.
Thank you.
Okay. One other question. The question is, when in the course of project development, when do you recommend researchers reach out? This person's applying for a grant now and has written plans, hopes about working with the NNE-CTR Community Engagement Core, but should this be formalized prior to the grant submission?
I think early and often, but it's never too late.
Yeah.
Early and often, I think, are really what we would like. In fact, you know, it only strengthens the application resulted with community engagement and outreach core.
Yeah, I was going to say the same thing, Cliff. I think it's going to strengthen anyone's application to show that they're listening to the communities that they're hoping to study.
The only comment I was going to add is that we have folks who have who are designated as navigators. But when developing a project, think in terms of navigation, expertise, and reach out to the broadest possible group of folks who could give you the kind of guidance in terms of the tools, the processes, and so on. Really helpful. And you're going to find that those questions will be welcomed.
Yeah, I think sometimes people are hesitant because they don't know where to start. And again, I think this idea of somehow having on the website where a person can inquire and say, look, I'm interested, where do I start? What's the first steps? Sometimes it can be very daunting.
So in the chat, so at Megan's question, we do have a question in the NNE-CTR form, a sign up form for community engagement consultation. We also discussed project ideas that the navigators discover on our biweekly check-ins for additional connections, collaborations. It's a comment. And then also from Emma, it's also important to be transparent and support funding in ways that support equity and build capacity in rural and underserved communities. Okay. All right. With that, I'd like to thank everyone for joining today, and please join us again on April 28th. And we'll be having a presentation by Dr. Abby Fleisch and Melissa Baird, an implementation of the Bright Bodies program for childhood obesity, helping kids and the families stay healthy and have fun. Thank you so much for joining today.
Thanks.
Great job, everybody.